Hello, this is Dr. Eric Bricker, and this is how health insurance works. Today's topic is diabetes doctors. What to expect. Now, first off, there's two types of diabetes. There's type 1 diabetes that requires insulin. Most people get it when they're kids, but you have to start taking insulin right away to treat it. The other type of diabetes is called type 2 diabetes. It is much more common than type 1 diabetes. Most people get it when they're adults, and you can either take pills or insulin to treat type 2 diabetes. Now let's talk about the doctors that treat diabetes. The vast majority of doctors that treat diabetes are primary care physicians, abbreviated PCP. Now, there's two types of primary care physicians for adults. They're family practice doctors and internal medicine doctors. And they treat the majority of people with diabetes, specifically type 2 diabetes. Now, there's another type of doctor called an endocrinologist, and that's a specialist. And that specialist typically treats people with type 1 diabetes, and then sometimes people with type 2 diabetes will see an endocrinologist as well. Now, the important distinction here is that primary care physicians with your insurance are often a $0 copay or a lower dollar copay, like $10 or $20 for an office visit. Whereas a specialist visit, an endocrinologist visit, will almost never be free, and it will cost more, typically $50 to $75 a visit. So it's important for you to know that in advance. Now, let's talk about the pills that people take when they have diabetes. Very common medications are Metformin, Glipizide, and Glyburide. They are generic, they're very inexpensive. For many insurance plans, they're only $3 a month, and for some insurance plans, they're free. Now, there's a brand name diabetes pill called Jardiance that is very expensive. It can be like $500 a month. Sometimes, if you have really good insurance, it'll be a $20 copay, but you have to get prior authorization from the insurance company. In other words, you have to get special permission from the insurance company in order to take this medication because it's so expensive. So be prepared for that. Next up, of course, there's insulin. There's lots of different types of insulin. Not all insulin is the same. Let's just use one example called Novolog, which is fairly common. Another name for it is Aspart insulin. It costs $277 a month on certain insurance plans, and again, other insurance plans, it's only $40 a month. So make sure you check your insurance plan to see how much your insulin is going to cost you. Finally, you need the supplies, the glucometer to check your blood sugar level. That's going to be about $10. The lancets to prick your finger, those are going to be about $15 for a pack. And then test strips to put the blood on and then stick in the glucometer. Those are going to be about $20 for a pack. Now, depending upon how many times a day you have to check your blood sugar will depend upon how quickly you go through the test strips and the lancets. So how much it costs you can vary. But I wanted to go over the basics of doctors and medications for diabetes. And that's how health insurance works.